start. This is the greater curvature of the stomach. From the greater curvature of the stomach, greater momentum arises, forming the greater sac. And from the greater curvature of stomach, the gastrosplenic ligament arises, which attaches the gastric, the stomach and the spleen, the gastrosplenic ligament. Similarly, the stomach and the diaphragm is attached somewhere here, the gastrophrenic ligament. And okay, so the other ligament which arises from the diaphragm and attaches to the colon forms a phrenicocholic ligament, which is also known as a sustentacular spleni ligament, which is responsible for holding the spleen in position. So when there is a splenomegaly condition, this ligament does not allow the spleen to grow longitudinally downwards. Rather, it will be growing obliquely. So whenever the patient comes to the condition of splenomegaly, you should be palpating this way. Similarly, to palpate the liver, you should be palpating this way, reaching the inferior border of the liver. Then so from the lesser curvature of the stomach arises the lesser omentum, forming the lesser sac. This is the lesser omentum, and this narrow passage this foramen is the epiploic foramen, which is also known as the foramen of Winslow. When you insert your finger, you are entering the lesser sac. So the region below the lesser omentum is the lesser sac, where you will be palpating the portal triad, that is your portal vein, bile duct and the hepatic artery. Done. Then entering the greater sac, this is your transverse colon, this is your transverse mesocolon, and so talking about the flexures, this ascending colon bends this curvature of ascending colon and the transverse colon near the hepatic region, the liver, forms the hepatic flexure. Similarly, near the spleen, the transverse colon, which continues as the descending colon, forms the splenic flexure, which is near the spleen. So this flexure is known as the splenic flexure. And this descending colon continues as the sigmoid colon. Sigmoid colon continues as the rectum, and there is a pouch formation here, which is known as the rectovesical pouch in males, and in females it is known as rectouterine pouch or the Douglas pouch. And the other pouch near the which is known as the hepatorenal pouch, near the liver and the kidney. This is the kidney. This kidney is a retroperitoneal organ, so the peritoneum covers the kidney. So this pouch is known as the Morrison's pouch. This ligament, which attaches the diaphragm to the liver, is known as the falciform ligament. So this bulged region, or the bulged part, which attaches to the falciform ligament, is known as the ligamentum teres hepatis.
Significance: ligamentum teres hepatis.
This region is known as the iliac fossa, and this is the superficial inguinal ring. So deep inguinal ring can't be made out, it's removed. So this region here forms the inguinal canal. This is the spermatic cord, the testis, epididymis, the sinus of epididymis, the upper pole, lower pole, anterior border and the posterior border. And this is the visceral layer, the parietal layer of the tunica vaginalis, and that's of the testicle. Then okay. Okay.
Iliac
So when the abdominal aorta branches in the iliac region, it is known as the iliac arteries, and when it crosses the inguinal ligament, that is been termed as the femoral artery. So similarly, the iliac veins are known as the femoral veins.
As soon as it cross the iliac crest.
Iliac ligament.
Ligament.
Inguinal ligament.
Inguinal.
Sorry. When the arteries from the iliac region, that is the iliac arteries, the common iliac arteries further divides into external iliac and internal iliac. When these cross the inguinal ligament, they have been termed as the femoral arteries.
Similarly with the veins.
Large intestines have the rough foldings known as appendicitis epiploicae, whereas in the smooth intestine these are absent. That is the major differentiating factor between the large intestine and the small intestine. The covering of the colons, that is the larger intestine, is known as the mesocolon. This is the transverse colon, so it is known as transverse mesocolon. Similarly, the peritoneum, which covers the small intestines, are known as the mesentery. This is the root of mesentery that is seen in the relation with the stomach. And
Fundus of urinary bladder.
this is the rectovesical pouch, and here comes your urinary bladder. Bladder తోచుంది. Bladder. ఇట్టు తోచుంది.
ఇక్కడ తోజాయా?
This is a urinary bladder.